Some members of the Vermont statehouse are hoping to regulate religious ministries after lawmakers say some offer misleading and inadequate health care coverage. Now, we don't know how many are operating in the state, but lawmakers say they're hoping to eventually create more transparency around such cost-sharing organizations. ABC 22's Jordan Barber explains the history here. She joins us now live from the newsroom.
Thanks, Lauren. For those who may be hearing of healthcare sharing ministries for the first time, members pay into a shared fund for medical expenses. It's not, however, connected to a healthcare insurance provider. If a member gets sick, the thinking is that that pot of money could help pay for the medical bills. Representatives say complaints about these ministries are growing nationwide, but some sharing ministries beg to differ.
You know, some of these are really bad actors who prey off people at their most vulnerable moment who might not be able to afford standard health insurance.
A House bill introduced by Representative Connor Casey and Senator Rebecca White would require healthcare sharing ministries operating in Vermont to register annually with the Department of Financial Regulation. They'd have to submit financial and membership reports and disclose their limited coverage so Vermonters can make their own decisions.
And I don't mean to say that everybody who runs a healthcare sharing agreement is a villain. Not everybody is taking advantage of people, but they're operating very much like insurance and they should be regulated as such. And there are bad actors who need to be identified.
Fish Stark, the executive director of the American Humanist Association and the Center for Free Thought Equality, has helped to pass a similar bill in Colorado and is supporting Casey's efforts in Vermont.
These organizations are operating at such a low level of transparency. We don't even know how many healthcare sharing ministries are operating in certain states. And so access to information is a good thing.
Joe Noble, the director of public policy at Samaritan Ministries International, tells me that as nonprofits, ministries are already regulated, and bills like the one introduced in Vermont, he says, misrepresent the organization.
It is very much just like a church if they were to pass the basket or pass the hat and take up funds to help someone with a medical need. This is just an outpouring of our members' faith to take care of each other.
Noble tells me the Alliance filed a federal lawsuit against the legislation passed in Colorado in 2024, claiming a violation of its members' religious liberty. But a motion for preliminary injunction was denied by a Colorado district judge this past January. Says he hopes that any state looking into legislation will recognize the violation of constitutional rights. The bill won't go anywhere this session as it was only read once in committee in January, but the lawmakers say they're trying to call more attention to it in the hopes of potentially bringing it up. Reporting live from the newsroom, Jordan Barber, ABC 22 News.